movie.
Thanks a lot, sir. Actually, one of the inspirations for movies and looking at your movies and looking at the videos that you've won has inspired most of us in the room here. So I'm going to deconstruct as to what I look at when I'm making a movie with the sole intention of trying to get into the award ceremony. And that's how I'm looking at things. The first thing you need to do is have a solid idea. You need to think it through, you need to find out and have a solid idea. But once you're done with the idea, you need to do hard work, because it's not just the idea that will get you there, but it's what you do with the idea that will move you ahead. So I just want you to notice this video. This is a polar cataract that's undergone a cataract surgery. We are winding up, coffee is getting done, everything is getting ready to wind up the day. And this is just a standard routine hydration, but not always things go as you plan. And why is it that this video is interesting? I'll show you again if it plays again in slow motion. This video is interesting not only because the posterior capsule gave way with a simple stromal hydration, but for the fact that I have this video with me. And why is that? It's because I'm recording all my surgeries. So if you want to make a video that involves cataract surgery, refractive surgery, any other surgery, it's very important to make a habit of recording all your surgeries, even the uneventful ones, because you don't know where the action happens. And for this, it's once you've done that, and then the whole story starts. Then you want to decide whether you want to choose a theme, you want to focus on what points, don't complicate, keep it simple, keep it relevant to the audience that's listening to it. Obviously have good quality video content, and keep in mind time is always restricted. You're playing at an 8-minute schedule and not more than that for most films. So first things first, good recording setup is what you want. Once you go to the industry and you look at all these cameras, you will look at their price points and you will jump, because it's not cheap. All these medical grade cameras are really expensive. Again, you need to understand your microscope to understand what your beam splitter is, what these video adapter tubes are, and what cameras to use. But for most of us, the good news is you don't really have to use medical cameras. We moved from medical cameras, we tried our hands at, these are cinema grade cameras that we are using, significantly 1/3 the price of a medical grade camera, on which feature films are made. So this is by Canon. And eventually I've shifted to pure SLR based recording to the theaters, because simple to understand that the sensors are larger, these full frame SLRs, so the zone of recording is larger and it's crisper. But once you have your setup, doesn't mean you have a good video. Like I said, apart from recording all your videos, you have to pay attention to details, mostly on where you are centered and what is happening. And for that, sometimes it's very difficult, because as a surgeon, you are so involved and so engrossed in the surgery that you tend to drift away. So it's best to zone in, or otherwise have a spotter. Like if you see my anesthetist and my technician here, have an eye on a big screen, which is always in the OR, and they tell me very blatantly that you're not centered, despite how bad the surgery is going, or if I'm in a complex maneuver, they've been instructed to tell me to make sure that everything is centered. And I'll just show you a video, and when I talk of centration, this is an old microscope. This is not even one of the latest microscopes. And this is Dr. Vaishali. She's operating a pediatric cataract with an anterior capsular axis, posterior capsular axis, and she's implanting the lens in the bag. What I'm trying to bring out here is it's a toric lens. You want to see how well centered the eye is. You have zones on both the sides. Your area of action, which is the IOL, not the conjunctiva, not the cornea, is well focused. And you take your time to make sure that everything is centered. You use zoom in and zoom out to add cinematic effects every now and then, because when you crop these and show it in these presentations, they will add a lot of aesthetic value. Once you have the videos, like I said before, it's in my hand, what works best is to be very myopic in your approach and have that 1 or 2 points that you want to bring across, because you want it to be easily palatable for the audience as well. Like I said, time is limited. So you need to build up a story in that time. You want to start, build up a pace, and then bring it down so that the person and the audience understands. And for that, it's very important to write a script from a narrative point of view and make sure that you time the script. Sometimes points are very difficult to come across, or if they come across, sometimes it's not very lucid. So it's always good to set up some experiments. Now you don't need to have very fancy labs for this. So I'll just show you. That's my daughter, many, many years ago. Now she's almost 11, but this was when she was 4. And the iPhone just came up with a high-speed camera. Okay. It's the beauty of using things, like high-speed camera, that these are moments that you can capture. This is the first generation. But then we used this many years ago in ophthalmic surgery. We wanted to see what happened when phaco happens and when these plumes come out. So we bought a camera from Singapore, imported it. That time the iPhones were not there. And the plumes that you see or the lens milk you see is ineffective phacoemulsification, causing emulsification, but no aspiration because your ports are blocked. And these plumes are the lens milk that you see. This is just 300 frame rate, as much as what you have in your phone right now. And I paid a huge amount of money for this. But it was thinking out of the box that helped us bring this point across. And we did win an award for this film. Vitrectomy. What we do is a pars plana vitrectomy. And why we do it is to understand that when you drain vitreous back into its natural compartment, you are able to preserve the anatomy and not extend a PCR. As you can see over here, we're doing a vitrectomy, and the vitreous body just prolapses down back into its natural compartment. It's an important concept, but sometimes very difficult to put across. So we decided to do a Miyake apple view. We decided to make our own Miyake apple for this film, and we used an old 1FR microscope, broke it down, put it upside down, hemisectioned an eye, and it's a cadaveric eye. So we are recording from the top, operating from the top, and recording from the bottom. And this is so you, when you do a limbal vitrectomy, your area of approach and your angle of approach is very limited because you're only going through the area of PCR. Only so much you can tackle with a limbal vitrectomy. On the other hand, if you do a pars plana vitrectomy, let me just move ahead, yeah. So if you do a pars plana vitrectomy, not only do you access the area of the PCR, but you can go way beyond it to clear. This is it's a visually striking image of what happens inside the eye, which as eye doctors we don't get to see. We all know what we're doing, but sometimes it's very difficult to see and make out what's happening unless and until you show it from a different perspective. To show the same point, we use a simple experiment, a sheet of plastic and some cotton wool, to show that if you do a limbal vitrectomy, you pull the entire vitreous body up and you enlarge a PCR from a small to this huge big mess. This is typically what happens in a cataract surgery. On the other hand, if you do a pars plana vitrectomy, as you can see over here, you pull it back. And the moment you pull it back, your PCR doesn't enlarge. And this brings the point home. So thinking out of the box sometimes may be very helpful for you to put across that point. Animations play a big role, and this is one of the films where we won the grand prize in the ASCRS. The entire film was based out of puppeteering, but I wanted to make animations and we ran out of budget. The one thing that I realized works wonderfully in all our hands is simple PowerPoint. So this is all animations just to show you that as nuclear sclerosis happens, your contrast goes down. And for this, you don't need any high-end setup. You just need a PowerPoint and transitions, and beautifully you can put across loss of contrast and things like that. Sometimes you can make animations, and instead of using animations with the PowerPoint, you can use models like I used clay to show femtodelineation, and how if you remove layer by layer using a femtosecond laser in a posterior polar cataract, the blue being the posterior polar, which is adhered, you can slowly cleave out different areas of the lens by keeping the epinucleus cushion, and when finally the only epinucleus is left, gentle wave of fluid can cleave off the posterior polar cataract. Again, simple animation to do or a simple model to make using a simple clay model. Okay, all right. Just move out of this. These are all animations. This is another patient where I wanted to go back to this. This patient came to us, was extremely unhappy because he had visual problems. And if you notice, the moment we do a UBM, we realized that somebody had put a multifocal lens, partly in the bag, partly in the sulcus. And the doctor was getting the blame for the multifocality. So we just want to understand the optics. Again, PowerPoint, to show that if you put the eye in perspective and you see one of the major optics in the eye is tilted out of place. And once that happens, you get terrible aberrations, which has nothing to do with the lens, but nothing to do with the quality of the lens, but everything to do with the poorly structured lens. All we did for this patient was push this lens back into its capsular bag and a well-placed IOL, and the patient was comfortable. To finally wind up, I use Adobe Premiere Pro to edit my videos. You can use anything that you want. You really don't have to use complicated things like this. But please give your own voiceover. And for this, I normally rent out radio stations for an hour or two, and I go and give voiceovers, record. This is one of the doctors, Dr. Shail from our institute, giving his voiceover for the film. And now be very wary of copyright, because copyright is a big issue. So please use open source material or make sure that you don't have copyright infringements. And all this over the years has, respect and encouragement from peer has always given us over the years lots of awards. And I thank you for this talk. Thank you.
Thank you very much, Samaresh. So while Soonpik gets set up, just one quick question. You've given a lot of pointers. Which do you think is the really most challenging part of coming up with a new movie every year?
I think of the many challenging parts, the most challenging part is to come up with the relevant topic.
It's the inspiration, it's the angle, isn't it?
Exactly. And sometimes it's the going back. You don't really have to invent something new, but you have to look at the old thing from a different angle. If you think you know something that has not been brought up, you can bring it up, but you have to be very, very sure of that 1 or 2 points.
That's such a good point. You know, my wife is an ophthalmologist as well, and sometimes we look at these movies and she says, no, that's old, that's new, but you've never presented it. You've never identified that tip or technique as something worth doing. And really, that's the essence, isn't it?
Yes.
Focusing in on something and developing